Good afternoon, everyone. Welcome to the International Seminars on Health, a course offered by the Postgraduate Program in Nutrition at the Federal University of Santa Catarina. I am Ana Carolina Fernandes, one of the professors of this course, together with my colleague Deborah Rieger, that is coming right now. We are pleased to have you with us today. Some students of the course are also here in our StreamYard platform and others via our YouTube live stream. Today, you have two speakers, and we will first start with Ulises Pallares, he is from Argentina, but he works at Canada. And our student Eric Cardozo will be hosting him. And I just want to say hello to Ulises Pallares and thank you very much for being here with us.
So I am Eric, the PhD student in nutrition at the Federal University of Santa Catarina. Good afternoon, everybody. I thank for Ulises for being here with us. He's a credentiated evaluator with more than 20 years of experience in evaluation, public policy, and international cooperation. Throughout his career, he has worked with organizations and initiatives related to governance, public sector innovation, and practice in Latin America and internationally. And currently, he is associated with the Canadian Evaluation Society and the American Evaluation Association. He has participated in one of our meetings on the Research and Extension Group in health assessments last year, associated with the postgraduate program in collective health from the University of Santa Catarina. And since some of our PhD students has been using the contribution analysis on their researchers, he's gonna talk about this method, about this approach with us this afternoon. For those of us who are interested in public policies and methodological approaches in research, it's a valuable opportunity to learn from his experiences and perspectives on international collaboration and evaluation practices. So thank you again, Ulises, for being here with us today. And now I would like to hand over the floor to you. So you can start.
Okay, thank you. Let me start by thanking you and the university for the invitation to this presentation. I'm very excited to be again with the university this year. And today I'm going to present to you one approach that is called contribution analysis. And this approach is particularly helpful to assess the impact of complex interventions. What do we mean by complex interventions? Interventions where there are multi-level governments participating in the delivery of a program, multiple stakeholders. It's usually when the intervention looks messy. So just to share with you an overview of our conversation, of my presentation today, that will last approximately 25 minutes. I will share with you the context of, I'm bringing today, the example of a client I worked with a year and a half ago. And I will present the context and their needs so that we are all on the same page and we understand what was the intervention about. Then I will present how I address the client's needs. And then I will focus on how contribution analysis works in practice. And finally, I will share with you some methodological reflections. So to give you an overview, in Canada, that's where I'm based, 47 of the international educated health professionals, we call IEHPs, are underemployed. This means that they either are working in they may be doctors, but they are working as nurses. It may be that they are, usually they are overqualified. Many of them can't get a job in the field that's related to the regulation is very demanding. So the client that engaged with us, one has been working in the sector, in the healthcare sector, for quite a while, but since 2020, this is just before the pandemic hit, they've been advocating for a comprehensive strategy to support the integration and the employability of the international educated health professionals, the IEHPs. So basically, it's try to resolve this problem in the policy landscape. So their work had three pillars. First is that they wanted to have a multi-sector collaboration. They would bring, the value of their intervention was about bringing together stakeholders from government, health institutions, community organizations, and the private sector so that they can get coordinated so that they can provide a solution, and the solution basically is about changes in the regulation to better employ IEHPs. They did a lot of work about building data so that they could show the problem that IEHPs face in Canada. And they also a big part of their work was about centering IEHPs in the solution that was going to be built. This means like making sure that IEHPs were empowered so that they could have agency to advocate for themselves. So one thing that I want to share with you, because this is what happens when we are working with complex interventions, is that this client in particular didn't have a strategy right away before rolling out their program. On the contrary, what they follow an opportunistic and adaptive approach. This means that they were responding to the change and the opportunities that were coming up in the environment. So this meant that they would engage with those that they knew. Those could be at a ministry level, deputy ministry level, directors. So this organization had a lot of contacts, and they wanted to influence, to leverage those contacts, so that they could influence ultimately the change in the policy landscape. Of course, they also, during that process, they started to develop more technical notes, those would be brief technical environmental scans, different kinds of technical documents that policymakers ultimately would find helpful in the policy making process. And they also did put a lot of effort on convening stakeholders. This is bringing together different both government, civil society, and the private sector through different platforms like conferences, webinars, having one-on-one conversations that were particularly important. For example, when with high officials, usually they were able to convene these different stakeholders at that level too. So what did the client need? The client wanted to understand their contribution to the evolution of IEHP policy landscape in Ontario and at the pan-Canadian federal level between 2020 and 2023. So we're also covering the period within COVID. So they worked. So I want to pause here. I want you to remember a few things. At this one, they are trying to work at the provincial and influence policy changes at the federal level with an opportunistic approach in the healthcare sector, where there are multiple stakeholders with very strong mandates. The focus was not simply to understand whether the change happened, but they wanted to understand the nature of the change, the significance, and the credibility of the client's contribution to the specific changes in the policy environment. And they also wanted to draw lessons from the evaluation so that they could learn what they could have done differently or they could have done better to influence changes in the regulation. So the core evaluation question was not, did the client cause this change? And this is very important. It's not about assessing attribution. It was about, the question was different. The question was whether the client made a meaningful contribution to the change and how confident we could be about that contribution. So this is, I guess that you are getting to the point here. What we are recognizing upfront when we are working with this. When we're doing contribution analysis, we are recognizing or acknowledging that the stakeholder or the intervention is part of a much larger and complex system of actors and interventions. So how did we, to respond to their question, like we used contribution analysis. As I was mentioning, into this approach was selected because there was the client was operating in a complex environment involving multiple activities, actors, relationships, and pathways of influence. So we wanted to understand to what extent the client was contributing to changes in the policy landscape, understanding that they only played a part of it, because they are more like, I can talk about legislators, the bureaucracy, regulators, licensure bodies, also the own community organizations that represent doctors and nurses here in Canada. So this approach was particularly appropriate for this intervention because the intervention was ultimately about advocacy, policy influence, relationship building, agenda setting, and capacity strengthening. So that not only one organization sets the agenda, for example. We are recognizing that it's a dynamic process that is influenced by multiple stakeholders and dynamics. So I brought here a quote from John Main. John Main is the person that conceptualized the contribution analysis. He passed away, but he is Canadian. And he says that contribution analysis uses a stepwise perspective on causality to assess whether the intervention made a difference. It did so because it was a necessary part of a causal package that generated or contributed to the change. In other words, the contribution analysis requires to follow 5 to 6 steps, depending on the approach that you pick, to understand whether the intervention made any kind of change. Especially the change that is expected. And I will get there in a second. So this is just for you to have an overview of what the steps look like. First one, there are 5 steps. The first one is to refine the evaluation questions, and I will talk more about that. The second one that is critical for this approach is to develop a robust theory of change. The third one is to gather evidence. The fourth one is to develop contribution claims. And finally is to strengthen the contribution story. So I will walk you, we're gonna talk now about these 5 steps so you can understand what's happening during each of the stages. So let's see how this looks in practice. So the first one is about clarifying the causal question. This can look like pretty simple and evident. However, with complex interventions, you really want to understand what the client is trying to understand. Broad questions are not going to be conducive. Why? Because the process requires this as you will see, contribution analysis requires the evaluator to assess step by step whether the causal pathway is happening. So if we have broad questions, it's going to be hard to collect evidence that is going to allow us to feel confident about that contribution claim that we will have to develop towards the end. In other words, if the question is not specific enough, we talk about what's the impact of the intervention, for example, the risk is that the evidence is going to be blurred. It's not going to be precise enough. So each step counts, and like getting good questions that are as precise as possible is a critical step. Then I will spend a few minutes in this section of developing a theory of change. This is for contribution analysis, the theory of change is not just one more step. I'd say it's a critical step in the approach. This is the backbone of the evaluation. This means that the theory of change needs to be fully fledged, needs to be very comprehensive to understand, so that we are explaining how change is expected to happen. So we need to go from the activity level all the way up to the long-term outcome. If that's, for example, that was the case of this institution in particular that was doing, in practical terms, they were bringing together policymakers and community agencies, and at the same, but with the ultimate purpose of changing regulation in Canada. So as you can see, these activities are of a very different magnitude of that goal. But to bring all these pieces together, we had to identify which were the mechanisms, what are those elements that are triggering the intervention, as well as the assumptions. The assumptions that are behind the theory of change are essential to develop our data collection tools, and also to have a story that it sounds reasonable. It's like, yes, this is credible. I think that this makes sense. So here I wrote this, the theory of change helped us to clarify what changes were expected, which actors needed to change, because remember that this is an advocacy program, so there are some mindsets that needed to be changed, people that had to be convinced about certain things, people that had to do things differently so some regulation could pass. Then we also identify the assumptions that underpin the client's strategy. And we don't want a theory of change that has, as you probably know, that has tons and tons of assumptions. We want to identify the critical assumptions of the theory of change. We also wanted to identify which pathways of influence were possible, and what types of evidence would be needed to assess the contribution. And I will talk more about the evidence piece in a few minutes. So how did we build a theory of change? I think you will find this helpful. Of course, we read program documents. We also did a lot of literature review, desk review. We did consultations with the staff, and we had a pretty good understanding of the system. This is, in particular, how the healthcare sector works in Canada at the federal level and the provincial level. So while this can be like something evident for people that are like doing research, I want to I will get back to this in a moment. Okay, so this is these are the theory. A few things to mention about the theory of change. The program documents helped us to understand, okay, how, because they didn't have a strategy. So the point was about bringing together the intervention and making sense post facto of how the program was supposed to work, because there was no strategy or there was no program up front. So we had to rebuild the intervention based on program documents, and the literature was very important there to also to understand how these kind of interventions are supposed to happen. So in this case, we had to review materials of other interventions for changing regulation in the United States to understand what are the pathways that are expected to happen, how people change their mindsets. We also use archetypes. Archetypes are models that explain how some specific changes are expected to happen. So we brought all that evidence that it's already out there, all that research, and it was included to have a very solid theory of change, a good understanding of how are we expecting things to happen and why. Again, because this is the backbone of our of our evaluation, and that's going to be kind of our compass to go and ask questions and ultimately come up with the contribution claims. And of course, we engaged with the staff because they were critical for providing critical information. So the theory of change helped us to test different things, whether here we have where there was a stronger collaboration across institutional mandates. We also whether there was increased political willingness to support IEHPs, whether there was a more shared understanding of the problem. In other words, the theory of change helped us to understand what were the expected outcomes of the intervention. But the expected outcomes had to be mapped out throughout the whole process, because as you know, we have early, medium-term, and long-term outcomes, and the theory of change helped us to map that out right away. So one thing here I want to highlight what is at the bottom of this slide, that the theory of change, as any theory of change actually, was not treated as fixed. It was actually tested, refined. That took, for example, the theory of change took, I think, 5 iterations. So just for you to understand how sophisticated this tool ended up being. So let's focus on the third step about gathering data. Contribution analysis doesn't prescribe what is kind of a methodology for collecting data we have to follow. It can be mixed method, it can be qual, it can be quant. So that's not something that if you read about this, you are not gonna find any strong prescription about that. So it's about, but what you need to have is the lines of evidence that are good to support the tracing of those outcomes that you're expecting to find along the theory of change. So in this particular case, we did document review, qualitative interviews, focus groups, and then we triangulated the data. I want to focus now on the document analysis because it was what I want to share with you is that the document analysis helped us to really focus on and to understand what are the contextual factors that are playing a role why these people are trying to change the regulation either at the provincial or federal level. And through documents, we could identify emerging issues like COVID came up in some of the documents. We also were able to identify early policy efforts related to practice readiness assessment. So through documents, it could be, and I want to be very clear, these documents could be published, could be private documents like emails, it could be videos. We used a lot of videos that were online. Also, we would read agendas to see what kind of things they were discussing, who was part of that agenda, Was person the agency A is still participating 1 year later in these kind of conversations? Did new organizations join these kind of conversations that this client was convening? So it was a lot about identifying what were the contextual factors that were identified there. And also the document was super helpful to identify the key activities that the organization was conducting. So for example, facilitating connections among IEHP's representatives, all the piece about networking with academic and other institutions, also developing communications tools to strengthen advocacy. For example, they created a toolkit so that IEHPs could advocate for themselves in the national media. So all that required us to see what they were doing, so we could trace that first part of the theory of change. And of course, we would see, this is the exciting piece, you start to identify emerging outcomes. We could see whether some issues were having more coverage in the media, for example. We could also see where there was improved coordination among IEHP actors. Like we could see that through the agendas, through the meeting notes. So there's a lot of documents there that the documents helped us to identify those things. But of course, that was the initial step. Then we had to do interviews and focus groups. And there are two things that are important here to highlight. The theory of change, because what I'm explaining is that you trace all the changes along the theory of change. So the documents helped us to identify those activities and early outcomes, but then we needed to identify the intermediate outcomes. And that the way that we could do this for this particular project was through interviews. And to develop the interview protocol, we had to pay attention, go back to the theory of change, because we had to know what changes were expected to happen, what were the critical contextual factors that may have influenced, which were other stakeholders that were also part of the policing landscape that could have also influenced that change. So Here you have some notes in the lower part of the interview protocol, but when it comes to the sampling strategy, that also was very important, because this was such a sensitive issue in terms of who people that have making decision power, that we also had to have a sample of understanding, okay, who are the ones that are advocating, and then who are the ones that are expected to change their behavior. And that was something that we factored in when sampling the interviews. Okay, okay, 5 more minutes, and I think, we're good with time. So then how we go from collecting data to creating contribution claims, there are 4 steps. One is to identify relevant activities and outputs, as I mentioned before. Then we trace plausible links to outcomes. So here it's a lot about asking how might those activities have contributed to changes in capacity, behavior, relationships, or agenda settings. So these are the kind of course, these things are built into the interview protocols or through the line of evidence that you are deciding to follow. And then you test those links that the number 2 comes from a theory of change against the evidence that you collected. What are the documents are telling? What the interviews are saying? And that's when triangulation becomes important, because sometimes you have competing explanations for why something may have changed. So some people may say this institution played a critical role helping to change Article A, B, and C, but another organization may have a different understanding, may think that it's a collective that really had a big influence. And then the fourth claim is the fourth step is to develop the contribution claim, and I will explain more in detail. So we have to think this is whether the contribution claim is about whether it's plausible. So this is logical. And to understand the piece about logic, there are two elements. There's the piece of what is expected to happen and is in the timelines that are provided or that are expected in the theory of change or in the intervention more in general. Then whether the activities occur as described in the theory of change. And then everything goes back to these things happened as we anticipated in our theory of change. Did the pathway happen as expected? And we also have, of course, this is the most important piece actually, I'd say, we need to identify the context and the influential factors. There, in contribution analysis, is not just about saying this, the intervention caused or contributed this way. It's about identifying what are those contextual factors that were explaining how the change happened. And that also includes identifying other actors and other competing explanations for why the change happened in that way. I will be very here to assess how confident. There are two things that you need to assess, at least when doing contribution analysis. One is understanding the significance of the contribution, whether it was and whether we are confident about the claim. We used a three scale system for the contribution. So the contribution could be high, medium, or low. So high in our case meant that the contribution wouldn't have happened, most likely, if the client hasn't been there. Low is the contribution would have happened anyway. The contribution was little. And medium is something in between. And confidence is we are assessing something different. It's about how confident are we about this contribution claim that we're going to make. It can be high, so that means that we have multiple data points or lines of evidence that are supporting this claim. Medium, there is a balance. It's like it's not that clear, or there may be competing explanations. And finally, it can be low. It can be like we are not that confident about the contribution claim. There's limited basis to support the conclusion, but we cannot fully rule out what that explanation. So I will go very quickly through this. The contribution basically explain what the contribution is about, how it happened. Number three, what was the outcome, the significance of that change, whether it was high, the contribution was high, medium, or low, how confident we are about what we are saying, and then the caveats, basically saying there are limitations to my understanding of this contribution. And the caveats are important because that's what shows how rigorous we have conducted our evaluation. Here I have just an example so that you can see how this lands. For example, the client contributed to strengthening the capacity of a stakeholder alliance by providing technical support, convening support, access to decision makers, and strategic guidance. This support helped the alliance become more coordinated, more visible, and better positioned to engage in policy conversations. So the first sentence is basically something that I can trace through the document review mostly, but the second part of this contribution claim, the coordination, the visibility, the better position to engage in policy conversation, that's something that usually, in our case, came through interviews. And each of these statements has to be backed up by evidence. The significance was high. Basically, we're saying this alliance would have not been coordinated if it wasn't because of the client's intervention. We're very confident about what we're saying because we've heard this multiple times through different data sources. And there is a caveat. This is all, we're still understanding that this contribution is part of a broader ecosystem. So This is very quickly. You have to, I mentioned this before, there are methodological limitations, and you have to acknowledge them. You have to identify, basically in this case, that there are limitations about the use of qual data, that the sampling strategy may also have bias, the results of what we found. For the third point is that where there's an uneven distribution of evidence across stakeholder groups. And I think that what my main point for that I'm trying to convey today with this slide is that you need to pay attention to the limitations so that you avoid over-claiming, because you don't want that, right? Because this is, you can assess impact, but in a different way. So you have to be extremely careful about how you are treating data. And these are the final slide. Contribution analysis requires a strong theory of change, as you could say here today. The evidence must be triangulated. The third one is important, that contribution claim needs calibration. So this means that the claim should need to be proportionate to the strength of the evidence. So that requires a lot of editing, being extremely careful how you present your claim. Don't forget that the context matter, because as I mentioned many times, this contribution analysis is helpful when you are working in a complex context. So you have to acknowledge that there is a complex context throughout the evaluation. And what I just mentioned, that the limitations strengthen credibility. When you are clear about what you can explain and you cannot explain, that's when you are perceived as a trustworthy evaluator. Okay, so that's my presentation for now.
Thank you very much, Ulises. As we can see, it's a really, really hard approach. Just as we know that public policy evaluation it usually is really complex and involves lots of steps, but contribution analysis can be even harder. So I thank you very much for the presentation and for sharing the experiences with contribution analysis. It was really inspiring to hear you and your perspectives on program evaluation and research development. So we have a few questions, and considering that we have 20 minutes, I will make like 4 questions, and we can keep on chat. So the first of them involves the complexity of some interventions and policies, just as we have in Brazil some decentralized programs, just as national school feeding program, and our health system, for example, that is implemented on the municipalities regarding like national laws and directions. So my question is, how can this approach be adapted for this kind of public policies as the National School Feeding Program, considering that profile of being decentralized?
Yeah, so the program, so the backbone is a contribution analysis, and as I mentioned before, we have a theory of change, but when you have multiple interventions that are contributing to a big program, what you can do is have nested theories of change. Basically, this means that there is one overarching theory of change that explains how the program is expected to happen in general, but then the nested theories of change can explain how that program is translated at the local level, and what are the connections between the local level and the provincial or federal level. So nested theories of change is kind of, for those who are not familiar, is like somehow you zoom in and you say, okay, I'm gonna, within this part of the program, I'm gonna pay more attention to this section. Or it can also mean understand contextualizing the intervention based on the dynamics of the ex municipality or the stakeholders that are in that municipality, or the different kind of things that need to happen at that level of government so that the program can be implemented. So what I'd say is in methodological terms, one alteration could be including nested theories of change.
Okay, perfect. So this question reminds me of our colleague Priscilla, who is working with contribution analysis on the school feeding program. So it's really valuable for her, who is probably watching us from YouTube right now. And I would like to make some other short questions about your international collaboration and academic networks, considering that you have been studying and working in Canada for some years and worked with different international partnerships and networks. Since the objective of this course is strengthening these kind of partnerships and these kind of networks, we would really like to hear you talk about how international academic collaborations are often described as essential for scientific development. And in your experience, what makes a research partnership truly productive and sustainable over time?
Okay, thanks for that question. Let's start with the part about the productive piece, how to make it work. I think that there are a few key factors. One is having common interests. So that's a key factor for these partnerships. But within those common factors, it's also going to be important to understand what's the unique value or art proposition of each organization or the researcher. So basically, it's about understanding what are the different, while there is a common understanding, what are the different skills and capabilities that the different organizations are bringing to the table. It can be either between two, or it can be between two universities, or two a funder and the university, or another technical agency and the university. But I think that the common interest needs to be there, but it's also important to understand what is that unique value that each organization is bringing to that partnership. Then when it comes to sustainability, I think that there are a few things that help. One is having a concrete example to work on. So this is delivering together, going from the stage of intention to the delivery piece. This is especially important for the sustainability piece that you were talking about. And while delivering together, it's going to be important to have joint successes. That's important for any relationship, actually, right? To say, okay, then we can build off of this. And also having joint failures, but that the two organizations, three, or the cooperative can work through together. Because successes are good to pave the way for that partnership to last in the long term. But with a long-term relationship, you expect also to go through challenges, and it's gonna be important to be able to own them collectively, the successes and the failures. I think that another element for the sustainability piece is to it's gonna be to have a stable group of researchers on both sides. that they can give continuity to the agenda that it's being discussed. Especially, this is especially important at the senior level. Those are those people, especially early on in the stages of a relationship. That's very important.
Okay, perfect. For us, it's really valuable to hear you because it has been like the beginning of the PhD for almost all of us who are in this room with you. So we are still over building these kinds of networks and understanding how these processes works through the academic area and research area. So thank you for sharing the experience. So I think you answered this question that I would supposedly to make, but if you have some point to add over this question, just feel free to. So if you don't, we can step to the last question. That is, what practical strategies or opportunities would you to recommend for PhD students and early career researchers from Latin America who wish to build international connections?
Yeah. Okay. I have quite a few pieces of advice here. The first one that I'd say is get to know the organization that you want to engage with in detail. But the important thing is the piece about in detail. It's not get to know the organization. I want to highlight that piece. So usually international organizations are not small, are very big organizations with very complex dynamics. So you really need to know where you want to work, where your interests are. Usually international organizations, I worked for the UN for many years, so there is usually a part that is operations, another part that is more related to strategy and research. So if you are a PhD student, probably will, depends on your interest, because if you want to have like a lot of applied knowledge to the intervention, you may want to go and engage with the department that does operations. For example, I worked for the Inter-American Development Bank. We have the health unit. So if you want to be close to the operation, you need to go and try to understand what they are doing, what their programs are there. But if you are much more about doing pure research, you want to go and reach out to the research department. But that's not the only department. If you are also interested in strategy and evaluation and measurement, then there's a department that does, it's called Strategy and Effectiveness Development Department. So this is just an example, a very minor example of when I'm saying get to know the organization in detail. It's not, you need to treat them and treat these big international organizations are so massive that you need to understand which department you want to work on. And a few more things that I would say is another important thing for you, guys, show up, connect with people, and prove your value. It's important when you're trying to, you have to be in contact, connect, and prove your value right away. And I think that this is the part of what I've seen, is that people that go directly from academia trying to engage with these organizations may come across as too academic. I will be very honest. So it's important to do some kind of reskilling or getting to know people that work already in this sector so that you can know how to land your message in a better way. Because if you come across as too academic, people may end up perceiving you are very good, but you just know what the book says. So it's kind of and it's not the case, but that's another thing that I would highlight. Make sure that you show up, prove your value, but prove your value needs to be massaged. It's about making sure that when you deliver your value, that the value will resonate with the people you want to engage with.
Thank you, Ulises. We have some question at the YouTube. So I think it's short question. If it can be shared. Okay. This is about if you have had used something. Sorry, I'm gonna I'm gonna read it. Have you had experience in using contribution analysis in culinary interventions? Justifying this question, I think almost everyone who is watching us is nutritionist or dietitian. So I think it's a point for us, the interest about food and nutrition interventions. So if you had some of those experiences before, not necessarily in culinary intervention, but in nutrition or food policies, be open to share with us.
Not really. And now I'm curious. Now, Bruna, I'm curious now about contribution in culinary interventions. The answer is no, but what I want to share with you that you may find helpful is that a lot of these big organizations, including the World Bank, they are using contribution analysis to assess a lot of their interventions. So if you want to see whether these are there's something about the application of contribution analysis in this sector, I would invite you to go and visit the World Bank. I know that they are working on this. They have a big flagship initiative going on around contribution analysis. They've had it for quite a few years now. And FAO may also be another organization, the Food and Agriculture Organization. They may have some experiences. But I don't have that experience, and I haven't run into. That's what I'm thinking as I'm talking. I haven't read anything about culinary contribution analysis in culinary interventions.
Okay, thank you for your answer, Ulises. We are about to finish it. So we had like 30 people watching during all the chat and presentations. So we thank you very much for your time. We really appreciated your presentation and the explanations about this approach that is so important to evaluate complex interventions and programs and policies. So I would like to thank you very much for being with us. It was a great pleasure to learn more about your work and perspectives on program evaluation, and especially this last discussion about international research collaboration. So I should say that your contributions will certainly enrich our discussions and inspire our group. So thank you very much, and we keep in touch. It's really valuable to have your contact and your partnership. Thank you, Ulises.
Ulises, thank you very much. We really appreciate your advices, and we have more 5 minutes left. So Professor Manuela Jomori, who is also from UFSC, is asking you, do you think contribution analysis is able to detect if self-efficacy in interventions based on social cognitive theory is a good component to change or predict behaviors?
He's not hearing us, Anna. Can you hear me, Ulises? So Anna made a question to you that was sent in the chat on YouTube. It's on the screen, but I will read it. It is from Jomori. do you think contribution analysis is able to detect if self-efficacy interventions based on social cognitive theory is a good component to change or predict behaviors?
I'd say I would be curious to know more, but it's got the potential because let me put it this way: contribution analysis is an approach. So everything will, as I was mentioning before, it's a lot about having a very solid theory of change. And if, for example, if the pathway around self-efficacy is built into the theory of change, the theory of change would help you to trace in a very thorough way how that change is expected to happen. So the answer is yes, as long as the change in self-efficacy is included into the theory of change. And the point with self-efficacy is that it's a concept that includes many changes, right? That there are many behaviors that are expected to happen around self-efficacy. So you would need to account for all those changes and how those changes are interrelated into the theory of change, and then test that change. So yes, as long as it's built in the theory of change, and then of course you collect data that supports the understanding of how the causal pathway was expected to happen.
Well, it's really complex. Thank you. You have to have lots of experience. As you said, not just an academic background. It's pretty complex, but the reality is complex. So thank you very much, Ulises, for sharing all your experiences. And you are invited to stay with us because we will continue with Dr. Fiona Lavelle, who will share her academic journey and research on culinary nutrition. That's why we have those questions about culinary interventions as well. And I don't know if Julia is already here.
Thank you. Sorry, I can't hear Anna. I couldn't hear you, but I want to thank again for the invitation. I really enjoy preparing the presentation for today, and please let's stay in contact. And congratulations for this initiative. And also, I wish all the PhD students all the best with your studies. I know that it can be hard, and it's a lot of dedication and commitment. So I wish you all the best with your studies. And please reach out to me if you need anything.
Thank you very much. Oh, I'm so sorry that he's not hearing me, but I would just ask people here in the StreamYard if you are hearing me.
Hello, here we are hearing. Thank you, Dr. Ulises.
Hello.
Hello. Sorry, is it echoing still?
No, now it's good.
No?
Okay, so now I'd like to ask our student Julia Leo, who is now with our second guest in person in London, to introduce her. Thank you, Dr. Fiona Lavelle and Julia.
Thank you. I'm gonna briefly present our guest now. So, hello everyone, my name is Julia Leo. I'm a master's student in nutrition at the Federal University of Santa Catarina, and it's a pleasure to introduce to you all our second guest speaker of the afternoon, Dr. Fiona Lavelle. She's a lecturer. Let me just show you. We are together. She's a lecturer at the Department of Nutritional Sciences at King's College London, and just recently, since my visit here at King's, became a collaborator of our project at the Federal University of Santa Catarina, which is entitled Nutrition's in the Kitchen. So Dr. Lavelle has a PhD in behavioral nutrition and works with women's health and exercise and behavioral and culinary nutrition. So the why, how, when, where, and under what conditions individuals prepare and consume food. And today she'll share with us her academic journey and research on culinary nutrition. So thank you, Dr. Lavelle, for being here with us today. And the floor is now yours. And later we'll have a little Q&A session.
Perfect. Thank you. Hello, can everyone hear me? Hopefully.
Yes,
Yeah,
we can
okay,
hear
perfect.
you.
Amazing. Thank you. And thank you for the invite to talk to you all today. I am going to speak to you a bit around my academic journey, and I'm going to talk then a little bit kind of some of the research, popping it in here and there, but I'm happy to answer all questions as well at the end. It does look like my slides have had a little bit of a shuffle, so if things are a bit all over the place, it's okay. But just in case, so the talk, I entitled it, Two Roads Diverged in a Yellow Wood and I Try Take Both. So if anyone doesn't know the poem, it's by Robert Frost, and it starts with two roads diverged in a yellow wood, and sorry I could not travel both and be one traveler. Now I can't remember the rest of the poem, but that is the start. So the whole point of this is that he took the road less traveled, whereas I like to make my life difficult and I try to take both roads. So that's kind of the theme of my overall talk and how I'll go through it. So I'll just give you a bit of context there on that. So as Julie said, I'm Fiona. I'm here a lecturer in the Department of Nutritional Sciences. That does give a bit of a spoiler at one of my crossroads that I am now a lecturer, but hopefully we'll continue through anyway. Let's see, can I get these? Okay, yeah, so we're a little bit over the shop, but just we'll talk through. But you can see there my two roads, and you can see a picture there on the left-hand side, and that is me and my younger sister. And that's just highlighting. So I started off in my school days as an athlete, and I was in martial arts for many a year, we will say. And that sparked my passion and interest then, and where my academic journey started. So I went to Dublin City University to start off, and I studied sports science and health, and obviously the sports track came with that. And then alongside that, I will say I am from a working class background. So in a sense, we obviously didn't necessarily have all the financial means. Julia has been explaining to me the difference between the university systems over here versus over there. It is very nice that it is a lot more accessible over there. So we do pay to go to university. In Ireland, it's not as expensive maybe as the UK, but it still costs a lot more money. So basically, alongside my academic journey, I've always basically had jobs working within the hospitality sector. So they were kind of my two roads. So when I was in Dublin City University studying sports science, I also worked in a children's play centre, and I was also a bartender at the same time. So I probably worked about 35 to 40 hours in a weekend, and then would go and work in the university 5 days a week as well. So it was pretty intense, but tries a bit of work ethic, right? But I just want to highlight then, so within my university, my bachelor's degree, it was an honours bachelor's. So we also got the chance to do a placement, and I was just so entirely lucky that I got the opportunity to conduct my placement in that's Australian Capital Territory Academy of Sport. So each territory or state in Australia has their elite sports center that all their top athletes go to, and basically we provide the sports science services, and they get all the psychology and basically elite training to then feed up into the Australian Institute of Sport. So if anyone's familiar with sport, it is quite a prestigious institute and well known for driving great athletes in Australia. Alongside that, typical Irish person, I found the Irish pub and I got a job there working as a bartender over there. Once I finished that placement, I returned to Dublin City University and I finished my degree in sports science. And I also continued working in the Children's Play Centre when I came back, but I actually took on a role as a cook in the kitchen. Hint, hint. What's coming? But I also was a bartender as well at that point as well. And when I was doing my sports science degree, kind of one of those components that really interested me was that kind of health and health behaviors, obesity, cardiovascular disease. So we would have done a lot of ECG readings and understanding how the heart worked and functioned, or maybe didn't work and function. So a lot of my interest and spark then came with that, okay, that earlier prevention, what can we do to prevent disease? So I had that kind of passion around health behaviors and understanding that more, even from that stage. And I moved less away from elite athlete performance, maybe more towards the health side of the degree at that kind of point. And from there, then I was accepted into Imperial College over here in London, and I conducted my master's in preventive cardiology. It sounds a lot fancier than it was. No. But again, the focus was on early prevention, and I specialized in nutritional weight management, exercise, and diabetes prevention and management. Again, very much preventative angle, but again, I was still like, this is talking about young adulthood or adults. It's talking about people who are showing signs. So how preventative is it? And I was very, very much along the line of, actually, hang on, we should really, really be starting earlier. But again, typical me, when I was over doing my master's, I was working as a manager in some bars and cafes in London. I was having a great time as well, I'm not going to lie. But I did probably work at the same time. I probably worked about 50 hours a week while I was doing my MSc, which was not, I don't suggest if anyone's doing an MSc, if possible, I would avoid working. But again, a needs must for financial reasons. And I did learn a lot of lessons and a lot of different style of communication and working with different individuals from different varying backgrounds. So it was a really rewarding experience for what it was. But it came to a point then, so I finished my MSc and I stayed working in hospitality for 2 years. And I did have my parents on my back going, what about all that lovely education you did, Fiona? And I was like, that is a fair point. And I am still very, very passionate about it. So I came to this point of a crossroads, and I actually was working, and one of the managers in the cafe, who owned a few different bars and all, offered to pay to train me up as a sommelier. Now, the fact that I struggle to say the word doesn't highlight that I was actually quite good, I promise. But that, or I then got offered a PhD in Queen's University Belfast, and it was looking at and investigating cooking and food skills on the healthiness of diets. You know, I had worked in kitchens, I was intrigued, and as you may have guessed, I went to Queen's and I did my 3-year PhD. And there were highs and lows, and I'm not going to lie, it took me a struggle to adjust to quiet Belfast over in Northern Ireland compared to big city London life. But it was really rewarding. I've made some amazing friends that I still talk to this day. I'm going over to visit them. Amazing opportunity and time there. And I was so lucky to conduct my research within the Institute for Global Food Security in Queen's. It's very well renowned for food science. But I actually worked under the psychologist for the institute. So we ended up being the consumer end of a lot of the food science projects, but it was a really rewarding trying to highlight how the behavior role plays into their food science and that translates their food science then to the general population. But I suppose I wanted to highlight during my PhD journey 2 of my kind of key publications and why I think they're my key publications. Partly because, so I'm going to highlight the Learning Cooking Skills at Different Ages paper and the Modern Transference of Domestic Cooking Skills. The top one, I'm very proud to say it has been viewed over 200,000 times, which I think is an amazing achievement on that one. So it has been a bit of a journey, that paper. But the reason I'm so proud of that one is because I was doing my PhD within a wider project, but I very much advocated for the point of, well, actually, surely when we learn the skills should matter on how we perform them currently and whether we perform them. And this came from my sports science backgrounds, where they would say, 10,000 hours to become an expert in whatever your sport is. And I was like, surely there's some translation in this that when we learn will have an impact. And I fought to do this analysis, and I fought to submit this paper into the International Journal of Behavioral Nutrition and Physical Activity. And it got in, and it's obviously now doing quite well of a paper. So it's just to highlight that if you do have a passionate point in your PhD or something you think is a really key insight, to do drive with it and do continue and think about it and explore it further, because you don't know where it'll come or what will come from it and what will come to fruition. And then the second paper I want to highlight is also this Modern Transference of Domestic Cooking Skills. And this was like a secondary analysis of the overall focus group study. And what when I was conducting the focus groups, I kept noticing was that the mothers in the group kept discussing their children. And I know now when we think about it, we would be like, that's quite normal, Fiona, we would expect that. But that wasn't within the research project's remit at all. And I was like, this is something that we really, really need to do an actual analysis on it and look at the data that these mothers are talking about. And that came to this paper then as well, and the modern transference. And this paper highlights the lack of transgenerational transference of cooking skills. Also quite a key paper and highly cited. And it just has become one of those papers that is showing that there is this lack of transference in the home for various reasons and eligible reasons. But it is happening, within the Irish context anyway. And then within that, it also highlighted a point that the parents, they themselves at a very, very young age were very much involved in food preparation, food skills and cooking skills. And they talked about standing on a chair and leaning over the hot fire to stir the pot. They were too little to reach the stove. But then they themselves had such anxiety and fear around letting their children be part of the cooking process. So I really found this as an interesting juxtaposition. So I was intrigued by this and kind of kept this component in the back of my mind as well. Okay, so let's see, can we move forward? How will it look, this one? Oh no. Okay. Okay, I can't. No. Okay, I'm going to talk over this. I'll send the actual slide deck, so if anyone's actually super interested, they can click through the animations. I should have known better, but it's okay. So basically, I did worked approximately for 5 years as a postdoc in Queen's in the Institute as well for global food security. And this is just to highlight that I also have, within that, I had a 2-track. So I had my employed postdoc research, and then I had what I called my passion projects. So my employed projects included, so the first one there, you can see the UST, U-S-T, coming out at the top there, was trust. So it was consumer trust in the food chain. So I worked on that project. Then I went on to support one of the other postdocs on their nutrition and health claims research. From there, I moved into a project called Project DARE, which was food education in primary schools in a disadvantaged area of Northern Ireland. And I'm going to stop there because I'll explain what the red line was. But on the bottom was my passion projects. So alongside the same journey at the same time, I kept then with that children and cooking angle. So from our first study there was, and And actually, so that evidence-based guide to cooking skills by age, that little infographic was driven from the first study. So too bad that it's popped up there already. It's okay. But it's around, basically, we developed age-appropriate guidelines for children cooking skills, and this was based on their motor skills and motor functioning and motor competence. So again, I brought back into sports science. I worked with the human movement scientists, and we developed these guidelines, and we mapped the skills back to the motor functioning and had an international consensus. Then we moved from there, and we did I think under that I've put we developed, basically, so you can see the little child there with the cooking or the weighing. We developed Cook 11 and Cook 7, so they were age appropriate cooking skill measure, and we validated that measurement tool. I always tend to use this little girl because I think it looks like a typical, what people think of as a little Irish girl, little red hair. So that's why I make that joke there, but that's why there. So we used that one. And then from there, we went and developed an age appropriate co-created children's cooking camp. And we ran that as a bit of a pilot study with the next plan and phase to implement a full-scale trial. However, the red line that's coming down through that career journey there was COVID-19 in 2020. So this kind of interrupted everything at that stage. And there was a bit of disruption, as there was across everywhere, but in terms of projects, there was, I don't know, was it the same in Brazil, but because some research was public funded, it had to continue, whereas other projects were stopped. So basically, to keep the team running, we were shuffled across a few different projects. I ended up working on a few EU and COVID projects and convenience food projects. And then on the flip side, obviously with cooking being kind of a transformational component, the only outlet, I was asking Julia, did she make the banana bread during just the lockdowns? I think everybody made banana bread. So we then went back and we looked at COVID influences on cooking behaviours, and we did a cross-continental survey, and we actually had 2 papers from that, one around adult inclusion of children in cooking, and then one more general about the changes and the increase in cooking behaviours during the pandemic. And then we also did a second camp. So we did Cook Like a Boss, but we did it online. We had to design then the trial as just a pre-post intervention. We couldn't have a controlled arm due to ethical reasons, because we couldn't offer the program a second time during their kind of school breaks. So we just offered it to everybody for the chance to take part, and we got great feedback around it. And we did show a relationship between perceived cooking competence, perceived movement competence, and perceived well-being. And that's the first time that was shown with all validated measurement tools. So that was a real highlight of it. Oh yes, but also just as a point on, in 2020, while everything else was going on in the world, I actually also got my diagnosis of endometriosis. So I'm quite open and honest about that. That had severely impacted my sporting life as I went through, and why then I reduced down sports throughout from the impact of pain and not being able to compete at the higher levels and international levels, and having to reduce down. But I finally got the diagnosis in 2020 after a long struggle that most people have. But I'm highlighting that there because it'll come back up in a future story. But yeah. And then just to highlight, then we also then conducted other research, or one of my last projects in Queen's was a project around using smart devices in the kitchens, the potential behaviours around food safety, and how touching then those devices plus touching chicken or raw eggs, and the potential for bacterial or microbial contamination I'm a little bit behind on those papers. It hasn't come out, but please just wash your hands, wash your iPhone and tablets if you have one and you're working in the kitchen. There is a potential. It does last on the devices for more than 24 hours, that microbial, so please clean. But okay, right. And then from there, I came over to King's. And again, 2 pathways, 2 tracks, 2 roads. So I have 2 arms of research, behavioural and culinary nutrition and women's health and exercise. So you can see at the top there, I have a couple of ongoing projects, and I'm only naming a few, but I've one that's really focused in on understanding the role of culinary nutrition in nutrition and dietetics as disciplines. We have the Root to Tip project, which is all around including more peels and stalks and of like vegetables in food. And again, was having discussions with Julia here, and that it is more normal in Brazil, where it's seen as bizarre and disgusting over here, and there's very much food safety concerns. So we have ongoing research in that. We also just completed a project around cooking and food behaviours during the cost of living crisis on the island of Ireland, and obviously the impact and role of cost of living crisis, people having to stretch their food budgets, the stress of trying to manage it. We have what's being termed the working poor, so 2 working parents in families, and the family still having to rely on food banks. There's a lot of embarrassment in around this by the families, which is obviously really upsetting, and we want to then have to reduce the stigma around using food banks. But also on the flip side, there's over 40% of those who responded to our cross-sectional survey reporting food insecurity, which we could consider quite disgraceful in a high-income country. I'm going to get cancelled one day saying these things, but it is a reflection of how dramatic some of these impacts can have, and they've called for like policy level implementations and the government impacting and influencing supermarkets and trying to put controls on food prices so that the people can manage. On the other side, then we have the women's health and exercise, and I've really kind of developed this arm as I've gone through working here in King's. So we started off in a qualitative project around experiences of elite athletes during pregnancy and their postpartum return to sport. That led on and highlighted the gap in supplements, and that they don't have batch tested supplements to be able to take, so they may potentially be missing out on folic acid, say for example, because they risk their sporting careers. So from there, then we did a cross-sectional survey around the nutritional wants and needs of athletes for pregnancy and postpartum. Within that, we asked around menstrual health as well, and that led on to another qualitative project around menstrual health experience of athletes and how that interacts with their food behaviours and their exercise behaviours. From there, we were getting athletes presenting with different menstrual related conditions. So we got a small pilot funding project from King's that was called iCare, which is around menstrual and food and exercise behaviours in athletes with endometriosis and PMOS. So you can see they're obviously pulling in that lived experience, but also interacting and enacting strategies to mitigate bias. So say, for example, I don't conduct any of the interviews, I keep a distance in that side. I don't conduct the in-depth analysis. I am at the critical discussion stage. So, but it's also nice to feel like I'm trying to contribute back in the methods that I can to try help. And you can see there what I've popped up in the middle is some of the research then that crosses both roads, which is really nice, is around what we do in athletes and their cooking behaviours. So a really kind of nice crossover, and I feel like I'm coming full circle in the kind of discipline areas, or integrating everything at this rate between everything. So then I suppose just to highlight as well, I wish my whole job was educate or research, but I do have another side. I am a lecturer, so in terms of education here at King's, I'm the module lead for 3 modules, so 2 of the research projects modules and my newly developed culinary nutrition module. So you can see some of our students there during one of their activities. They were kind enough to pose for a photo. You can tell I need another coffee, even though it's too late in the day. But I am also the people and culture lead for the department. I'm the social and wellbeing committee lead. I'm the careers lead for the 2 nutrition courses. And I also do have some additional research projects ongoing that I haven't gone in depth in today, because it's trying to just give you highlights. And then I have my research team as well, who's working across different projects. So Kat and Sophie, I'd like to thank as well. And also Georgia, who has recently left us to go and do a PhD in Exeter University, but comes back for a bit of research assistant hours now and again. So she's still part of the team. And then just some of the points I kind of want to highlight for when it comes to culinary nutrition, because obviously that's kind of the collaboration we're working on here. Kind of key points, and I'm very much a strong and passionate advocate for progressing the area and developing the area, and how we keep moving and strengthening the evidence within the area. So it's kind of things we need to think about as a kind of collective. And I suppose some of the words are a bit, but it's okay. So basically, it's one of the key components of this, and like I'm very grateful that we have developed a collaboration. But one of the things is collaboration and openness to new methods and learning from each other. So I really think that cross learning is vital and important. Learning from past limitations, I will look at some of my earlier papers and think about, oh, I could have done that better. But we learn from our past limitations, from our limitations that were in the area, what we've learned, how we've progressed already, and keep moving forward. Learn from other disciplines, and you can see that I pull in from a lot of different disciplines all the time, from psychology to sports science to human movement, and amongst many, many others, including food science as well. I think we need to be clearer in reporting of our research, specifically the detail of our interventions. We don't tend to give a lot of detail on the actual content, which I think is a big challenge, because then we end up repeating some of the mistakes and learning from those. And I talk a lot about needing process evaluations and not just measuring outcome effectiveness, because understanding the mechanisms of the interventions is essential to understanding the parts that we should be repeating and not repeating, and the parts that may be transferable to other contexts or settings. That practical translation to make it up to policy level, I think, is essential. I also think we need to be critical in peer reviewing. We all hate reviewer number 2. It's always reviewer number 2. But we all learn from reviewer number 2, and it does usually help strengthen the papers. So I think it's really important that while we may be aware of different people and different programs, if it's not doubly aligned, be critical if there's something you think they could strengthen on, or if they could give more detail in areas. Do let them know. While we all may hate it when we get it in the beginning, it's really important then to continue and help and strengthen our research and how we report and what we learn, and the things actually, oh, I didn't think about adding that. Oh, actually, I have that data, but I just didn't include it. So it's really important that we learn from that and move forward. I think this is key as well, signposting to resources. So from when I started in this area, note I didn't add the dates to how long I've been in working, but since I started, the area has strengthened. There's been so many measures that have been developed and validated. There's been tools that can be transferred to other settings and contexts, and we do smaller validations on them. We don't need to repeat or recreate the wheel. That kind of sharing and collaboration or collaborative aspect will then help and stretch our limited resources within the area, so that we don't have to spend the money and time on developing a new measure for our study. That actually, there's one that was developed in Australia. We can just translate it and use it and do a little small validation study and see if it works for us. So I think that's one of the key aspects. Supporting each other for funding, I think, is also very an important aspect. If you're asked to review somebody's application for funding, or reviewing papers, reviewing smaller, I know this is PhD level, so if your colleague is applying for even small, I don't know, do you have PPIE, patient and public involvement? Okay. But smaller grants, so say if there's a smaller grant that you're applying for, even a travel grant, you know, and they ask you to cast an eye over it, absolutely give them a read of the application, give them your thoughts and support them in their development. And they'll hopefully do that back for you, and that kind of like supportive collaboration even amongst your colleagues, even if you're working on different PhD areas. So again, I was doing my PhD in amongst the food scientists. Not a notion about half of what they were doing, and they didn't understand what I did either. But we would all read each other's applications and try see if, okay, if I can't understand what they're trying to tell me, then actually they need to make it clearer. So even simple things like that would really benefit and help each other. And then in the terms of cooking, I suppose the final thing is trying to integrate culinary nutrition into other lifestyle interventions as well. So even if we can't get the big funding for our own studies, say, for example, can we embed it and work with other interventions? And we just embed the culinary nutrition component as best as we can. And we also assess our component as well. So that's a key point, that if we're including it, we need to assess it. And just because it is culinary nutrition doesn't mean your main outcome may be, say, for example, if they're concerned about blood pressure, that mightn't be your one, and you might want to measure an intermediate, and you could tell them maybe it's cooking confidence or it's diet quality or something, for example. So navigating that kind of territory, but don't be afraid to embed within other studies. And I suppose then I just want to acknowledge and thank everyone I've been working with over the years in the area of culinary nutrition and behavioral nutrition, and hopefully be adding a few more faces to the slide pretty soon. But yeah, so we don't work alone is kind of my key point of this. We learn from each other, and we learn different points and aspects from each other, and that by working together we strengthen the research and the research area. And you can see faces there from the island of Ireland to Australia. Ooh, I have a Brazilian in there as well. So, but again, as I said, it's working across the breadth and with people collaborating cross disciplines there. So psychologists, home economists to human movement scientists. We have sports nutritionists, psychologists, and everything in between. So it's just being open and learning from other people and gaining their insights as well, and seeing how that could actually help or strengthen your research. It doesn't have to be in culinary nutrition. Collaborating and cross-disciplinary collaboration is essential and provides such real nice insights as well. So with that, I'm going to finish talking there. There are my contact details if anyone is interested or wants to reach out for anything in particular, but I'm also happy to answer some questions now as well. Do I need to mute this then?
I think it's okay. We use yours.
Okay, yeah, perfect.
Okay, so thank you, Fiona, for having me, for having us here today. Thank you for our presentation, for your insights. I'm gonna start asking a few questions, and then I think we open up to whoever is watching us to make you a few questions as well. So first of all, I would like to ask you, what would you say has been your biggest challenge working with culinary nutrition so far?
Ooh. I mean, I will say probably one of the biggest assets. We'll start with the positive first. Okay. That the area is very open and supportive. And I do think everyone is willing to collaborate, and it's about reaching out and talking to each other. I think one of the biggest challenges is getting funding, and that has been probably one of the biggest issues we have had. So some of those studies I talked about, I had £5,000, and basically they are conducted through the goodwill and me owing a lot of favors to other postdocs and pulling them in, and we use the money to buy the vouchers for the participants, to pay the chef to record the videos, say, for example, and that was it. You know, we didn't take anything, we just worked because it was a passion. Yeah. So yeah, I'd say funding is a challenge.
I think we share the same challenge then.
Okay. Okay. Oh, that's not nice to hear at the same
Yeah.
time. I was hoping you guys would get more than us.
My second question is, how do you see the future of culinary nutrition? If there are any like fundamental questions you feel like are still open to be answered.
Ooh.
You can take a minute.
Very insightful questions coming at me here. So I want to caveat, obviously, as I said, I started in sports science and I was trained under a psychologist, not a nutritionist. So to me, I think we also need to focus on the well-being aspect a lot more of cooking and culinary nutrition. That social connection, that social aspect, and that positive side. Yes, if we get some dietary changes is obviously one of the goals, but there is so much potential, and I don't see culinary nutrition as a nutrition intervention. I think cooking is a multifaceted tool that can act across multiple levels on different aspects. It can look at reducing food waste as a tool towards reducing food waste, but it can be focused on diet quality, or it can be focused on increasing efficacy and confidence and autonomy and independence, and then it can have all mental health and well-being aspects as well. So I think moving forward, we should look at a broader range of outcomes as well, not just focusing on diet alone. It's important, and I'm not saying we shouldn't focus on it or have it, but look at the other range of aspects as well. And I think that would be key. And I think the well-being side is underexplored.
Okay. So I think I made the question to the right person, right? Because you're very interdisciplinary.
Yeah, well, that is it.
So
I'm like, include everyone.
Yeah. So as we discussed, we have like the same graduation in Brazil. So maybe we tend to look at culinary nutrition with like diet eyes, you know, and I think maybe you have a different point of view because of that.
Yeah, and potentially, because most people that are in culinary nutrition come from a food nutrition, mainly nutrition background, where I come with kind of a different angle and trying to look at the behavior. And I caught the end of the last talk, and obviously self-efficacy was a key point and one of the key aspects we focus on as well. And to be honest, some of my studies, we don't measure diet.
Yeah.
We ask them, do they like food? Do they recognize it? Especially when it comes to children, we don't even try to think about measuring diet. We ask their awareness and on whether they can recognize different foods, but we don't ask about changing their diet. We focus on the increasing confidence and increasing exposure to different foods, especially for children that may come from a background more disadvantaged background, that maybe actually the food they're exposed to in their home environment is all more convenience food. So
perfect. Thank you. My last question to you is, what advice would you give someone that is just starting their academic career, if there's some skills that you wish you learned sooner? That's very useful, a very useful question personally.
Well done and fair play to start an academic journey. It is not an easy position to get to. So I do think, even getting towards that needs to be recognized as an achievement. Probably celebrate all the wins, all the small wins. So completing a draft of a paper, submitting a paper. Academia is very, very, very tough, and there is a lot of rejection in it between grants and papers, and we need a lot of resiliency. But because of this, I do think we don't appreciate the amount of effort and how far you've come to reach these targets of drafting a paper. Like, it is amazing, and that should be celebrated, because that hard work might come then with a few setbacks between corrections or rejections, so getting to that point should be celebrated, and trying to acknowledge those wins to build up that resiliency as well, going, yes, I can do it. I drafted a paper, I submitted a paper, and focusing on the wins rather than maybe some of the harsher points in academia, I would say.
That's good. I think I can speak for maybe a few colleagues here that we usually think about, not that we only think about it, but we usually focus on what went wrong, right?
Yeah.
So yeah, that's good advice.
Yeah. And it's a hard one to do. We all
Yeah.
naturally focus and pick
Sounds
up.
easier,
Yeah,
right?
yeah. So that's what I'm trying to tell you. We used to have a bell in our office where if the paper was accepted, would ring the bell. But I think people should be ringing the bell once the paper's submitted as well.
Yeah.
Yeah.
Nice. Thank you. So I think now we can open up the questions.
I think you see them, I don't.
Yeah. But I think they will be shared.
Oh.
Yeah.
Hi, are you hearing me?
Yeah.
Yeah.
Ah, yes. Luana, please, can you put on the screen the second commentary of Bruna Maciel? Oh, yes, thank you. The second one, please. Fiona, Bruna is curious about how you think CN could aid in lifestyle interventions on a larger projects.
Yeah, fair question. I mean, it just depends on the type of lifestyle intervention, but I do think if there is a dietary component, having a culinary component is quite a nice way to strengthen that dietary aspect, because telling somebody to eat well, you know, great. Whether they listen, I don't know, but whether then they, not to be a negative Nancy, but whether then if we actually bring them in and they learn some skills or they have a fun time interacting, they may actually remember some of the key points in that side of it. Also, depending on who you're targeting with an intervention, culinary skills could be used to enhance motor functioning in children. So their manual dexterity, their motor functioning. So if they're practicing then cutting with a knife or stirring as well, maybe that will feed into actually enabling physical activity. So I'm not sure if it's the same in Brazil, but I know in Ireland they've found that children aren't developing at a normative rate when it comes to motor functioning. So actually maybe having this targeted approach would enhance their motor functioning, which then would enable the physical activity side or the well-being side.
We can't hear you.
Okay, I'm sorry. Thank you, Fiona. I actually have a question for you. Here at our postgraduate program, we have been working with culinary nutrition intervention for more than 10 years. And it was a surprise to us when the term culinary medicine emerged. For some of us, we are like discussing this in some researches in here. And we know that you work with culinary nutrition interventions and put this culinary medicine under this big umbrella. What is the same view we have in here, but the term for us is a little bit a rebrand of culinary nutrition intervention program, but aimed at physicians or the medicine students, but the content is like the same. Culinary nutrition is culinary arts plus nutrition, which is a health field. So we worked with health promotion and disease preventions, and also with disease treatment through the food. So I would like to know, what do you think about this new term, if you agree, because there are some primary studies that try to define this with consensus, and these studies recognize that culinary nutrition is something bigger, But the difference may be, I don't know if it's right or not, it's a point of view, that culinary medicine interventions has to have a health practitioner teaching it. But for us here in Brazil, it's like to culinary nutrition intervention, we also have to have this dietitian or other health practitioner who knows how to cook. So I would like to hear from you. What do you think about this concept, this new term? If you have some criticism or not, it's something like different.
Controversial. Well, I will caveat by starting with saying I worked in cooking research originally before it even was called culinary nutrition. So I will caveat that. And when I started in this research area, cooking wasn't even seen as part of nutrition. I was rejected from the nutrition journals. I was told I was a social scientist, a behavioral scientist, and this wasn't nutrition. Culinary nutrition is now accepted within nutrition, thankfully. And I work a lot with obviously nutritionists and dietitians, and obviously it's part of the program I put it in. I agree with what you're saying in terms of culinary medicine is culinary nutrition, but to medical professionals, in my opinion as well, that it's just another arm. And I know there is nice work from Croxford over in Australia. They've tried to put the definitions on. I don't know if any of you've seen the definitions paper, and they are trying to distinguish. But in my mind, it is basically teaching culinary nutrition to medical professionals. And I have heard from other colleagues, I was at the ISBNPA conference there, and they work in culinary nutrition, and they are starting a new course, and they've been advised to market it as culinary medicine because it's sexier. So the thing is, I think when medical gets attached to something, it gets increased credibility, or which is not necessarily right or fair or correct. But I think that's kind of what has happened. I will say culinary medicine has been around the term has been around nearly as long as culinary nutrition. They have been around quite a long time, both of them, but it's becoming more prevalent, I think, recently. Culinary medicine as a term is becoming more kind of out there. But yeah, I basically would agree. I would see it as culinary nutrition being taught to medical professionals. My other issue with that, in a sense, is that they then think that by teaching culinary medicine to medical professionals, that they are teaching them nutrition as a whole. And they think that's a stopgap to teach nutrition. And I don't agree with that either, as a very much a concept that I agree with culinary nutrition is a part of nutrition, but you cannot teach the whole of nutrition through one module to the medical professionals in that sense. So I do think that's also a danger, because then if, say, for example, they think they have a lot of nutrition knowledge and then it gets reverted back onto culinary medicine, then it will discredit the culinary nutrition side more. And that's where I'm a bit worried about the balance of how this interacts, and that we have to make it clear that they're going to use the term culinary medicine, that's fine, their choice. I mean, but that we need to be clear that that is not the same as teaching medical professionals nutrition. But yeah.
Wonderful. It's very nice to hear it from you.
I'm definitely getting my set. I'm getting cancelled, guys. Okay.
Yes, I know it's a very important initiative, but just like the term, we are conducting a scoping review to study the use of this term in studies about culinary nutrition intervention for health professionals, not only for physicians or the medicine students. And it's it has been conducting, but we have already seen that some of these interventions are not hands-on and are very short. So it's something like you were telling us, that they are not going to teach, to learn nutrition. It's just a part to make them understand and to facilitate the prescriptions and just to explain how to do that prescription, but they are not going to learn dietetics and nutrition. So maybe the use of the term is not uniform among the initiatives, because there are very good initiatives these days. Also here in Brazil, to teach the students, the medicine students, and with hands-on classes, with an entire course to do this. But it's not like the same for all the studies. So it's a little bit dangerous to use this to classify something that it's not unique and it's very diverse, but we can keep in touch to exchange some discussions on this topic. But for us, it's very interesting to see your journey, your both paths, that I think it's very important to us to hear from you, the experts in the field you are studying, that the life's not a straight path, that you go to the academic path. You have the life doing these curves, and also the personal experience who may change everything and make us more passionate and with more skills to develop our work. And it's brilliant. It's brilliant to see your career like in this scenario, in this context. So thank you very much for receiving Julia, for staying here with us to share your journey. I don't know if Julia wants to say something else.
Again,
You're grand.
for your talk, for having me here, for your advice on like I told Fiona that my English is not Englishing today, but to commemorate, is that a word? Yeah, the little steps.
Oh yeah.
Yeah, so I'll work on that.
Yeah, exactly.
And yeah, thank you everyone that's watching us today as well. I hope it was insightful to you. Yeah.
Thank you very much. And you have the second day of the seminars the next week at the same time in a YouTube channel. So you are all invited to come back, and thank you very much. Bye-bye.
I can't even hang up this thing.